Dr. Gladstone, can you provide a recap of some of the important points from your presentation on suturing?
Yes, the presentations that I gave at the meeting included one on ear reconstruction and one on suturing beyond interrupted stitches. The first on ear reconstruction, the most important aspect of ear reconstruction is maintaining symmetry. And there are a number of ways of doing this after Mohs surgery or excisional surgery. I spoke about a number of different types of flaps, including the wedge excision, which is good, but it has some limitations. Really, the workhorse flap for ear reconstruction is something called the chondrocutaneous advancement flap, and that was first described in 1967, but it's evolved over the years, and it's important because it can maintain symmetry of the ear. The key point with the chondrocutaneous advancement flap is that, like other advancement flaps, you have to advance it, but you're going to get most of your tissue reservoir from the inferior aspect of the ear, and you can incise it all the way down to the earlobe and then advance that flap, and it heals very nicely. There are other types of flaps I also spoke about with more challenging defects that are larger that include cartilage. You can remove cartilage from the conchal bowl and then sew it onto the helical rim to recreate that curvature, and then use post-auricular staged flap that you attach. It's essentially an advancement flap, but you attach it and then divide it and reset it at 3 weeks, and those tend to heal very nicely, again retaining the curvature and symmetry of the ears, which is most important. So ears are challenging, but very satisfying for any dermatologic surgeon or dermatologist reconstructing ears. My other presentation was on some interesting suture techniques beyond the interrupted suture. And the three that I focus on are: one, the pulley stitch; two, the cerclage stitch, also known as the purse string; and three, the suspension stitch. The pulley stitch is a good strategy to use on difficult to close defects. And basically it's a pulley. The technique essentially is what we call far, near, near, far. And by doing that technique, you can bring together the two sides of a defect. You have to use it a little bit sparingly. It does work very well, but it can cause tissue necrosis if you use it too much, but it's an excellent technique. The second stitch, known as the cerclage stitch or the purse string, I just prefer cerclage because it sounds better, is you can use it on difficult to close areas, particularly on the tibia or on the scalp. You can use it to partially close a defect, to completely close a defect, or to use it in conjunction with a full thickness skin graft. And it works very well, and I describe those techniques. The third suturing technique is known as a suspension stitch. This is used also to close difficult to close wounds, or for those wounds that are near areas, anatomic areas that you could distort potentially, particularly the lip, the alar rim, or the eyelid. And this basically is a suspension stitch that's adopted from facelifts, and it's also known as a pexing stitch, and it just decreases the tension in the wound, so you can it gives more looseness to the tissue, so you can just close it primarily much easier without distorting tissue, and it works very well. And so those are three key sutures that I think any dermatologist should have in their repertoire beyond the interrupted suture.
Do you have any general insights on surgical dermatology and how clinicians can stay abreast of new approaches and techniques?
Well, I love surgical dermatology because it's continuing to advance, and the way dermatologists can stay abreast of it is, aside from reading journals and going to meetings such as the AAD, of course, or the ASDS, or other meetings, is to have preceptorships or to do hands-on types of procedures. And that's very important, and particularly going to these meetings where the AAD has had, the hands-on filler course. I think that's very important on how they can keep abreast.